Understanding the menace of addiction. Addiction is a complex and multifaceted phenomenon that has been extensively studied from scientific, neurological, psychological, and genetic perspectives. It is characterized by the compulsive and often harmful use of substances or engagement in behaviors. Despite the awareness of adverse consequences, the scientific understanding of addiction has evolved significantly over the years, shedding light on its underlying causes and mechanisms. Neurological basis. One of the fundamental scientific reasons for addiction lies in the brain's reward system. This system is primarily governed by the release of a neurotransmitter called dopamine. Dopamine is associated with pleasure, reward, and reinforcement. When individuals engage in activities that are pleasurable or consume substances that induce pleasurable sensations, their brains release dopamine. This release of dopamine reinforces the behavior, making it more likely to be repeated. Substances like drugs and alcohol have a potent impact on the brain's reward system. They can hijack this system by causing a rapid and intense release of dopamine. This immediate pleasure reinforces the use of the substance, creating a positive feedback loop that encourages repeated consumption. Over time, the brain becomes desensitized to natural pleasures and increasingly reliant on the substance to experience pleasure, leading to the development of tolerance and dependence. This neurological rewiring is a core component of addiction. The brain's reward system is not only responsible for pleasure, but also plays a crucial role in learning and motivation. It associates specific cues or contexts with the rewarding experience, creating conditioned responses. This is why individuals with addiction may feel intense cravings when exposed to cues associated with the substance or behavior. Furthermore, the prefrontal cortex, a brain region responsible for decision-making, impulse control, and rational thinking, is heavily involved in addiction. Chronic substance abuse can impair the functioning of the prefrontal cortex, compromising an individual's ability to make rational choices and control their impulses. This contributes to continued substance use despite the awareness of negative consequences. The balance between the impulsive drive to use the substance and the rational decision to quit is disrupted in individuals with addiction. Psychological factors. Psychological factors also play a pivotal role in addiction. Many individuals who struggle with addiction have underlying emotional and mental health issues such as stress, trauma, anxiety, depression, or other forms of psychological distress. These issues can act as triggers for substance abuse or addictive behaviors. People may turn to substances or specific actions as a way to cope with emotional pain or to escape from the harsh realities of life. Over time, the substance or behavior becomes a coping mechanism and a source of relief. This reinforces the addiction, as individuals may find it challenging to address the underlying emotional issues without the substance or behavior. This aspect of addiction is often described as self-medication. Genetic influence. Genetics also plays a significant role in the development of addiction. Studies have shown that genetic factors can influence an individual's susceptibility to addiction. Genetic variations can affect how the brain's reward system responds to substances, making some individuals more predisposed to addiction than others. Family history can be a predictor of vulnerability to addiction. However, it's important to note that genetics is not the sole determinant. Environmental factors, including upbringing, peer influences, and life experiences, also significantly shape an individual's likelihood of developing an addiction. It is the interplay of genetic and environmental factors that determines an individual's risk. In conclusion, addiction is a complex phenomenon with a robust scientific basis. It arises from an intricate interplay of neurological, psychological, and genetic factors. It is not merely a matter of weak willpower or moral character, as it was once inaccurately believed. Instead, addiction represents a condition that fundamentally alters the brain's functioning, leading to compulsive substance use or behaviors. Understanding the scientific underpinnings of addiction has important implications for prevention, treatment, and destigmatization. Evidence-based approaches such as behavioral therapies and medications are commonly used to address the neurological, psychological, and genetic aspects of addiction, offering a comprehensive approach to recovery. Recognizing the multifaceted nature of addiction can help reduce judgment and encourage more effective strategies for prevention and intervention. Thanks for watching. For more interesting videos, please like and subscribe.